Most people don't realize they're dangerously low in vitamin B12 until serious symptoms appear, and today, I'll show you the hidden signs you must never ignore. Number 1. Constant fatigue that makes no sense. If you sleep well but still feel exhausted, your body may not be producing enough healthy red blood cells. Low B12 reduces oxygen flow, making you feel tired even after waking up. Number 2. Strange tingling in hands or feet. This happens because vitamin B12 is essential for healthy nerve function. Low levels cause pins and needles, numbness, or burning sensations. Number 3. Memory problems or brain fog. People with B12 deficiency often say, "I walk into a room and forget why." This is because B12 supports brain and nerve pathways. Low levels can make you forget things, lose focus, or think slowly. Number 4. Pale or yellowish skin. Low B12 affects red blood cell production, causing pale skin. In more serious cases, it may lead to a yellow tint similar to jaundice. Number 5. Shortness of breath. If you get tired easily while walking or climbing stairs, low B12 may be the reason. Your muscles don't get enough oxygen, causing weakness and breathlessness. Number 6. Mood changes, anxiety or depression. B12 is needed for neurotransmitters that regulate mood. Low B12 equals low serotonin equals mood swings, irritability, sadness, or anxiety. Number 7. Mouth ulcers and burning tongue. A swollen, red, or smooth tongue can be a clear sign. Frequent mouth ulcers and a burning sensation are also common. Number 8. Heartbeat irregularities. Your heart works harder when you don't have enough red blood cells. This may cause fast heartbeat, irregular rhythm, chest discomfort. Who is more at risk? People over age 50. Vegetarians or vegans, people with stomach problems. Those using acid-reducing medicines, individuals after weight loss surgery. Best natural sources of B12: eggs. Fish, especially salmon, tuna, sardines, milk and yogurt, chicken and turkey. Fortified cereals. Should you take supplements? Some people need supplements because food alone is not enough. Ask your doctor to check your B12 level blood test before taking high-dose supplements. For more important health advice like this, make sure to subscribe to the channel.